Yet another disorder that we see in some children with ADHD, though much less common than the other disorders I've mentioned, is autism spectrum disorder, abbreviated ASD. As you know, ASD is a serious neurodevelopmental disorder seen in 1% or less of children and is characterized by severe deficits in social interaction, interest in other people, social communication, including language, and may also be associated with very odd and restricted interests and repetitive or stereotype mannerisms, such as hand flapping or other repetitive gestures. We often see very rigid or inflexible thinking or patterns of repetitive, rigid, and inflexible speech as well. About 20% of children with ADHD may also have autism or ASD, but usually it's relatively mild when it occurs. However, if a child already has autism, at least half or more of such children may go on to develop ADHD as well. So the risk of seeing ADHD with autism, or vice versa, depends on which disorder is already diagnosed or developed first. So you can see some figures here on my slide with regard to this comorbidity. Now, as I pointed out, one reason why autism may develop is that it shares some genetics with ADHD. So having ADHD does increase the risk for inattentiveness or ADHD specifically. We know when we see these two disorders going together that the poor impulse control or inhibition problems are due to the ADHD, whereas the social interaction, communication, and language problems are the result of autism. So we need to separate which disorder is leading to which difficulties. Where the two go together, we often see much more difficulties with the child using language to help develop their own self-control. And that is because of their language and speech delays as well. When autism and ADHD coexist, we have now learned that you can still use ADHD medication to manage the ADHD. It won't treat the symptoms of ASD, however, but at least it will help with managing the ADHD symptoms. In previous decades, it was thought that you couldn't use an ADHD stimulant with a child with autism because it would make the autistic symptoms worse. But subsequent studies have shown that is not true, that you can effectively manage the ADHD with an ADHD drug. So we're more likely now to use ADHD medicines where we see these two disorders coexisting in the same child. However, there are a few caveats or qualifications about these remarks on medication. First, the child with ADHD and autism is not quite as likely to show a strong or positive response to the medication. As you see here, about 75% of ADHD children respond well to any single ADHD drug. That figure falls to about 50% if autism is also present. Another thing we see is that there may be more side effects in the child with this coexisting pattern or comorbidity than we would have seen had ADHD been the only disorder. And there is an increase in the percentage of children who simply can't tolerate the ADHD medication at all. That risk increases from 3% to as high as 18% where these two disorders coexist with each other. Nevertheless, there is still a good chance that the child who has both disorders can take an ADHD medicine to manage the ADHD. Of course, the autism requires its own intervention because ADHD treatments don't help autism. So, we're going to need to apply intensive applied behavior analysis, one of the few evidence-based treatments for autism, or the parenting version of that known as the Early Start Denver model to help parents of preschool children alter their parenting behavior in order to try and improve the symptoms of autism. It's also possible that treating the ADHD with an ADHD medicine could make the child more responsive to these treatments for autism. Another disorder, more common with ADHD than autism are sleeping difficulties, as I've already mentioned. These are more likely to occur in ADHD children who have anxiety, but about 40% on average of ADHD children do have serious sleeping problems. Some of them, perhaps half of them, these are bedtime behavior problems, getting the child to obey at bedtime, to change out of their day clothes into their sleepwear, to stay in the bedroom without being disruptive in order to allow sleep to overtake them and occur. Where that is the case, behavioral interventions might be helpful. But we also see ADHD may produce some degree of insomnia or delayed sleep onset. ADHD does seem to affect our biological rhythms for sleep, known as the diurnal or daily rhythm, resulting in people not being able to fall asleep until later than typical people might do so. About half of ADHD children with a sleep problem have frequent night waking or early rising or signs of sleep apnea or breathing problems, or may even develop restless leg syndrome. That is, the child is very restless during sleep. Where this is the case, where we are seeing frequent nighttime interruption or signs of serious restlessness during sleep, then the child should be evaluated at a sleep lab to see if there are some interventions that could be used to help improve the sleeping, which then would help improve daytime inattentiveness, because as I've said before, a child whose sleep is inefficient is going to be tired, and tiredness, of course, is going to increase inattentiveness the next day. One factor that might contribute to an increased risk for sleeping problems is that families of ADHD children, at least here in the West, are more likely to allow their children to play video games or engage with other visual media or technology close to bedtime, that is, into the evening hours. And we know that these visual media can disrupt sleep patterns, perhaps because of the increased exposure to light through the device, or because of the excitement that such video media, such as video games, might cause in the child, making it harder for them to reduce their arousal in order to make sleep more likely. But for whatever reason, parents are using visual media to help entertain their child and manage them. But that use of visual media, particularly in the hour or two before bedtime, may be more likely to contribute to the sleeping problems. So what does it mean for treatment where a sleeping problem occurs with ADHD? As I've said, if there is evidence of sleep apnea, snoring, obstructed breathing, or very restless sleep, the child should be evaluated at a sleep lab and get the sleep disorder treated. Sometimes this may even include tonsillectomies or removal of the adenoids to clear the airway and allow the child to breathe normally during sleep. This can improve sleep and result in better sleep and therefore in less tiredness the next day, and that leads to better attention span. So sometimes we may see a surgical intervention used to improve the child's sleeping difficulties. But not all children with ADHD and sleep problems have obstructed airways during sleep, and those children, of course, should not have a surgical intervention to try and improve their sleeping. Sometimes the sleeping difficulty is due to the stimulant medication. Up to 30% and as many as 50% of ADHD children who take a stimulant are going to experience insomnia or delayed sleep onset from the stimulant medication. That can be managed by reducing the dose of the stimulant if that's possible, taking the stimulant earlier in the day if that's possible, so that the medication is washing out of the body before bedtime, or maybe even adding melatonin, that is the sublingual or under the tongue form of melatonin, at night to help the child increase the likelihood of falling asleep. Sometimes we have to stop the stimulant medication and use the non-stimulant Strattera instead, because Strattera does not produce insomnia the way stimulants do. And giving Strattera twice a day may also help with sleep onset, because Strattera is known to produce some degree of sedation or sleepiness in children, at least initially. So, the combination of sleeping problems with ADHD might alter the way we treat the ADHD if the stimulant medication is part of the problem in producing the sleeping difficulty. Parents can also improve sleeping problems by shifting to a more predictable transition to bedtime activities, what we call sleep behavioral hygiene. Many times, ADHD children have more disrupted families, and therefore their bedtime rituals are usually much less consistent than we see with other children. But regardless, it is helpful for parents to develop a very consistent schedule at bedtime. At least 1 hour or more before bedtime, the child should stop using visual media, stop watching television, stop engaging in very exciting or high-stimulating games and activities, and begin to engage in less arousing activities, such as reading or playing board games, or simply using more manual toys that are less arousing than video games might be. This might also be a time where the child could take their bath or shower in the evening to help further calm them down and prepare for bedtime. And then when they are put to bed, parents can leave a light on in the room or a radio playing soft music, or even use a sound noise generating machine to put that in the room to create sort of a static sound or other sound that often can help children fall asleep. Sometimes going from a very stimulating activity to a unstimulating bedroom is too dramatic a transition for ADHD children, and it worsens their ADHD, especially their hyperactivity. So by using this step-down transition to bedtime and less stimulation of activity, it can be helpful for an ADHD child. And then, as I've said, sometimes using melatonin can improve the onset of sleep by an average of 20 minutes, let's say, or more. Now, another disorder commonly linked to ADHD are learning disabilities, often called specific learning disorders. These are where we see very serious delays in academic achievement skills such as reading, spelling, mathematics, handwriting, or language. Where there is a dramatic delay, a serious delay in these academic abilities, we call it a specific learning disorder, or LD, learning disability for short. Between 35 and 50% or more of ADHD children are also likely to have a learning disability. The learning disability is not being caused by the ADHD, and therefore treating the ADHD is not as likely to improve the LD. It's going to need its own intervention. Here on the screen, you see the percentage of ADHD children who are likely to have these other disorders, such as reading, spelling, math, and so on. Now, having said that, there are a couple of academic or educational problems that ADHD does create. One is delayed motor coordination, and particularly delayed development of handwriting and poorer handwriting when it does develop. Treating the ADHD does help improve motor coordination and handwriting, particularly with the ADHD medications. Another problem that ADHD can create is poor comprehension of what we read, or what we listen to or hear, or what we view, as in educational videos, for instance, or watching a teacher give a lecture. Children with ADHD are less likely to attend to these educational media. They're also less likely to retain the information. They're more forgetful because they have a working memory problem that goes with their ADHD. Here again, managing the ADHD with an ADHD medicine often improves a child's comprehension of their reading, of what they view, and of what they hear. So in those two cases, coordination and handwriting, as well as comprehension, treating the ADHD first can be very helpful. But where there is clearly a reading or phonetics problem, a spelling problem, or a math problem, then treating the ADHD is unlikely to help those comorbidities. There is a little research suggesting that Strattera might help improve reading speed and articulation, but it is not as likely to improve spelling disorders or math disorders. These other disorders of reading, spelling, and arithmetic are going to need additional educational tutoring and interventions to help improve them. Now, interesting, at least 2 or 3 studies have found that if an ADHD child has a coexisting disorder of mathematics, known as a dyscalculia or arithmetic disorder, it markedly reduces their likelihood of responding well to the ADHD medication methylphenidate. And you can see that here. About 75% of ADHD children who don't have learning disorders, like mathematics, respond to methylphenidate. Those who have a reading disorder, it's only slightly less. About 67% are likely to respond to that drug. But notice here that where a math disorder exists with the ADHD, the treatment response is reduced by 50% or half, down to only a 37% chance that the child will do well on that medicine. So it's important to know what kind of LD a child with ADHD may have in order to evaluate what kinds of medications to use and whether the child will respond to them. So in conclusion, I'll go back to the diagram I showed earlier, and that is that ADHD has a high probability of being seen with these other disorders. as I've said, over 80% of ADHD children and teens have at least one or more of the disorders that you see on this screen. And at least half of them have at least two or more of these disorders. I hope in this lecture you've seen that understanding what the second and third disorder happens to be may have some impact or implications for how we go about managing the ADHD as well as the comorbid disorder. And it will also, as I've shown here, have some impact on their life course and their future risk for developing other disorders or other impairments. And as I've said several times in this lecture, often treating the ADHD early in childhood may help to reduce the risk of some of these other comorbid disorders, particularly oppositional disorder, conduct disorder, and depression. Thank you for joining me for this lecture. I hope that you have found it informative. Good day.